Hi, I'm your host, Marsha Florence with Just Ask. Today's show, ladies and gentlemen, is Encompass Healthcare. Hurry back and join us. Hi, I'm your host, Marsha Florence with Just Ask. Today's show, ladies and gentlemen, is Encompass Healthcare, and we have the house doctor himself, Dr. Bruce Ruben. Good morning, Dr. Ruben.
Good morning, Marcia.
Thank you for being here.
Well, thank you for inviting me. I'm really glad to greet you and bring some hope to your viewers.
Thank you, thank you. Now, Dr. Ruben, without a doubt, we have seen you on the network inspiring people and talking to people about health care. So we ask you to come here today and tell us a little bit about yourself and Encompass Healthcare.
Okay. Well, Encompass Healthcare and Wound Medicine was conceived from the specialties that I have. One is internal medicine, one is infectious disease, and one is undersea and hyperbaric medicine. And it's a facility that's very unique in our state because it accommodates disabled people and it provides services for both infections and wounds that aren't healing. So it's a pretty comprehensive wound center and hyperbaric medicine center. So we provide a number of services for people that we try to keep them out of hospitals. And that's something I've been doing since I left practice in 1991.
Okay, now do you have a specialty or is it all of those things?
I do have board certifications in internal medicine, infectious disease, and undersea and hyperbaric medicine.
Okay.
Yeah, three different hats.
Okay.
Three credentials.
So what made you want to put it all under one umbrella? I mean, you know, it sounds like a wonderful concept, but you have so much. So what made you want to put it all under one umbrella?
Well, what's interesting is that when I was a fellow training, people were in hospitals for several weeks getting intravenous antibiotics, and it seemed to be a very inefficient way of delivering care. So when I got out and I became an infectious disease practicing physician, I thought it might be best to try to get some of that treatment outside the hospital. And sure enough, I pioneered intravenous antibiotics in an outpatient setting. And so my primary focus was on infectious disease, treating people with bone infections, people with skin and soft tissue infections, pneumonia, kidney infections, and that worked out terrific. People were able to come right to see me as an expert, get their daily treatment, go home to their own home, eat their own food, come the next day, and they actually had their oversight by an infectious disease doctor. But over 10 years, I decided I want to expand my interests. And I found that very few people had exposure to wound care centers that were helpful. Mm-hmm. And so I decided I would take it upon myself to learn more about wound healing, and hyperbaric medicine became an essential part of that exploration because there's really no credential in wound care yet. Okay. It's not a specific specialty. So I then took my boards in hyperbaric medicine because it's an important part of the healing for certain individuals that have sores.
Okay, now you know I have to elaborate on the hyperbaric because a lot of people are like, what's hyperbaric? And I just wanted to ask you, could you touch on that?
Yeah, hyperbaric oxygen therapy is very old. It's at least 100 years old, and it really was set up by the Navy to treat people who had decompression sickness or the bends, and it's used really for that reason. And then over time, medical system got involved and found that there were a few medical reasons that it might be helpful to. And so at first it was used for a ton of different things that turned out it wasn't helpful for. But now it turns out it's very helpful for the things I mentioned. But what you do is basically inside a chamber, it's like diving to the bottom of your pool, You feel the pressure on your ears. And what happens when you take a deep breath and breathe only 100% oxygen, you get super saturated with oxygen, much like a bottle of pop gets super saturated with carbonation. And what's very much misunderstood, even by medical practitioners, is that you're not getting more oxygen on your red blood cells, but you're getting more oxygen in all the different tissues of your body.
Now, would this help a person with COPD as well, chronic pulmonary disease?
It's a good question. You know, COPD is a difficult disease, but in fact, COPD is one of those problems that hyperbaric oxygen is contraindicated. And the reason for that is people with COPD need carbon dioxide to stimulate them from healing, and if you use too much oxygen, they might stop breathing. So it's one of those things that wouldn't help. But there are exactly 14 different approved indications, and that's not one of them.
Okay. Well, the reason I ask is because when you say a hyperbaric chamber, and that means a person's going into the tube, and I'm going to make sure we show the picture. People are like, well, what am I going in this tube for? Will I be able to breathe? Well, will this help me with my breathing? And will this do something to my skin? A lot of people are asking questions that, you might have 1 in 10 that's brave enough to go in it, but the other 9 are saying, I don't think that I want to try that. Okay,
Yeah.
so it's almost like a method of persuading a person to do something to better themselves, but they don't know that it will because they've never experienced it.
Yes. In fact, most people who come look at it, and the ones who probably discouraged mostly are those who are claustrophobic.
Okay.
But in our chambers, we have it open, and when people can watch TV inside. And the treatment time's about 2 hours, and there's personal and directed oversight by myself. So people can get comfortable once they try it. And what's interesting is that you don't really feel anything once you're in there. You pretty much meditate and enjoy the dive, as we call it.
Okay. Enjoy the dive. Okay. Okay, and that sounds interesting, but, and when you say there is no certification in wound care, I understand that. It's just that a lot of times when people are dealing with wounds, they're concerned about their family members learning how to properly take care of the wounds along with them, or do they always have to go somewhere and, get the wound taken care of?
That's the best question I've ever been asked about for wound care. And the best answer I can give you is that in America, we like to take care of the problem as it looks to us. And the reality is the wound isn't the problem. People looking to take care of the wound as though that's going to be helpful to its healing. But what we do at Encompass Healthcare and Wound Medicine is look for the reasons that people aren't healing the wound, because God has given us the wisdom to heal our own wounds. We don't really need a doctor to do that. Our body's amazing. 11 trillion white blood cells a day trying to heal your wounds. So we don't need people. But what we do need are trying to reverse those reasons that sores don't heal. So a lot of people have the misconception that if I put a particular dressing on, or if I leave it open to air, that the wound's going to heal. But they should be reassured that your body can heal the wound if the things that are impeding healing are reversed.
Okay, taking that. Well, I tell you what, Dr. Ruben, we're going to take a break, and ladies and gentlemen, I know you all waiting for some more good information. We'll be right back.
Over 1 million Americans at risk of foreclosure have been helped by making home affordable. Find out now what your options are.
Home where I belong.
3 out of 4 kids are not as secure as they should be because their car seats are not used correctly. But the latch system makes it easier to get it right and to hold your kids tight. Anchor, tether, latch. Learn more at safercar.gov.
And welcome back to the second half of the show. Now, those of you who are just now joining us, you missed the good part. Well, all of it's good, but you missed the beginning of Dr. Bruce Ruben from Encompass Healthcare telling us about wound care, hyperbaric chambers, and a few other things that he's specialized in. So I want you to listen up, because you need to call us, 1-800-323-5336, 1-800-323-5336. Twitter, hashtag Marsha, and say, Marsha, I need to talk to Dr. Ruben. Okay, we'll make sure that you get in contact with him, because people who have health concerns such as wounds, wound care and things, I want you to take in consideration there is someone like Dr. Ruben out there who wants to help you out and make sure that you get the proper healing care for your wounds. Dr. Ruben, I had to say that because a lot of people who watch programs, you know, they say, oh yeah, sure, it probably costs an arm and a leg or something. And I know you probably take various insurances and things like that, which helps out, but I always ask people to at least come check a service out to make sure, you know, it's something that they can handle. Okay, so I want you to, if you don't mind, let us know what are some of the non-healing wounds that are out there in ulcers.
Well, it's a great question. First, people should know that if they should have a wound that's caused either because they've had surgery, they've had a burn, they've cut themselves, they've skinned their shins, they've had a trauma, they have a pressure sore, they should know that when those sores begin, they should come to an end in 4 weeks. The body should heal itself. That's what's most important, is that we probably all remember when we were a child, we hurt ourselves and we healed. We didn't need doctors. So it's important to remember what a non-healing wound is to begin with, and that's a wound that's probably still there after 4 weeks. So give yourself a chance to heal. So after 4 weeks, that's when it becomes important to seek the kind of attention and that I can give somebody. Okay. So a non-healing wound is one that if it's not healed in 4 weeks, that's when you need to find out why you're not healing your wound.
Okay. Now, do you believe or feel that nutrition is also playing a part, a person's diet is playing a part in the reason the wound may not heal properly?
Oh, absolutely. Absolutely, Marcia. That's, you know, one of the things that physicians should really be very vigilant about is one's nutrition. You need protein. You need adequate protein to heal a wound, just like you would need wood to frame a house to brick over. In fact, malnutrition is one of those 5 reasons that a sore wouldn't heal. Like if you had a non-healing sore, we would look at your nutrition. That's one of the factors, along with how your blood, your circulation is getting to the wound, or how your veins are returning from the wound. We also look at whether you have a bone infection. And one of the ones that people have the hardest time with is what's called repetitive trauma. So if you have a wound on an ankle and you're moving it like this, it's not going to heal. So we really focus on the reasons that are interfering with the wound, and once we get those reversed, then somebody can heal their wound and on their own.
Okay, but do you think, or I'm just asking, I'm sure it is, diabetes, a lot of people who have diabetes, when they sustain a cut or bruise and it doesn't heal right, okay, where would you come into play with that?
I think that's great. First of all, diabetes is not a reason that a sore doesn't heal. Most people are discouraged that they have diabetes, so they feel like their wound won't heal, but that's just not the case. Diabetes can cause things like poor blood flow, and diabetes can cause things like a lack of feeling in your lower extremities, but we can certainly do things to reverse those things by giving people appropriate shoes and giving people the resources to reverse their circulation problems, and their wounds will heal just fine.
Okay, okay. So what are some of the benefits of outpatient?
Oh, I think anybody who reads the newspaper probably knows about MRSA, MRSA. Hospitalizable conditions should be really critical care conditions, but about 100,000 Americans die in hospitals for things they never ever had in the first place. That's about 4% chance of succumbing in a hospital. So outpatient therapy, when it can be accessed, is safer. Okay. That's number one.
Is that almost like short-term stay versus long-term stay?
It's like staying safely in your own home and seeing your doctor regularly and having direct oversight and having almost personal attention to your care when you're in an outpatient setting. Most people are so much more comfortable at home. Because
actually, and I didn't mean to stop you from your flow, but when you said MRSA, most people who don't know what that is, can you elaborate on that? Because I look at it like you stayed in the hospital too long. So what does that entail?
Well, MRSA is Staph aureus. It's a common bacteria that lives on everybody's skin, and it turns out that about 50% of us have a brand of staph that's resistant to a common antibiotic called methicillin, which means if we gave somebody methicillin, it wouldn't kill the bacteria. So it's concerning that type of a bacteria is in a hospital setting more often than in the community or in the IV drug abuse population. But in general, we have significant armamentarium to treat people with this organism. So they shouldn't be afraid if they hear that word.
Right.
They really
Okay.
shouldn't.
Okay, but a lot of people don't know. I mean, to me, you can stay a little long. You're feeling better, and they're saying you could be discharged. Oh, no, I'm still sick. And then you somehow come up with something else.
Exactly.
You know.
That's right.
But on another note, if a person's at home and they have a bed wound, so to speak, somebody said, well, we're not turning them over enough. Most of the time, does that mean because they're not being turned enough that bed sore is steadily growing or increasing in depth inside the body?
Well, pressure sores begin because people are seated for too long and they generally don't feel their bottom. So for example, if they can't feel the bottom of their foot and they walk, they get a blister and a sore. So that's how they start. And what's most important is trying to get somebody off of the sore, which is to offload the pressure sore in order for it to heal.
Okay, and because it's not just the elderly person that most of the time would have a bed sore or wound like that. It could be anyone, wheelchair user that's in constant sitting position.
It's mainly our spinal cord injured population.
Okay.
So, as we sit here, you and I, we reposition ourselves because our bodies do that naturally to avoid pressure. But somebody with a spinal cord injury, they don't have feeling on their bottom, and so they might sit inadvertently for more than 30 minutes, and that could cause an ulcer. So they have to really be vigilant about taking care of a half of a body that they don't even feel. And so ulcers that develop from pressure usually occur in people who aren't aware of their skin at the time, or often in a hospital. Probably the most common cause is when you're hospitalized and no one's paying attention.
Wow. Okay. And it sounds strange, but a lot of times, like I said, we're trying to help a person, so to speak, our loved ones, and if they're bedridden or if they're a wheelchair user, he or she is fine because they look stable, but you still have to know that you need to rotate them or keep that area pretty much clean. Is it clean and dry, or because if an area is moist, that would make the wound increase faster? Is that what it is?
I think we should all remember what it was like to take care of a baby. And we know when a baby is wet, we get red maceration, and when they're dry with powder, their skin is fluffy. But the more important thing was what you said. It's about nutrition. So if somebody's well nourished and they have all the water that they should have, their skin will be very healthy, and they might be able to avoid ulcers. So it's another way to consider healing is again, let the body do what it's supposed to do.
Okay, all right. Well, Dr. Ruben, we got to take another break, but you heard what the man said. It's nutrition. That's part of the battle. But we'll be right back.
Everybody needs a helping hand. Take a look at your fellow man. Tell me, what can I do today?
Courtesy. Pass it on from the Foundation for a Better Life.
Mental health disorders are serious and treatable conditions. Isolation, loneliness, and changes in behavior could be signs that someone you know is suffering from depression. Learn how to recognize when family or friends are in crisis and what you can do to help. Mental health does matter. Contact the Resource and Crisis Helpline with your concerns at 1-800-231-1127.
And welcome back to the last half of the show. Now, ladies and gentlemen, I don't know about you, but I am very much enjoying Dr. Ruben here today because he's giving us insight on wound care, how do you pronounce it?
Hyperbaric.
Hyperbaric. I always try to get that word right. Hyperbaric chambers, things that you need to know about taking better care of yourself. And he stopped with the information on nutrition. And what I want to say to you about nutrition is that you may go to the physicians every day and say this wound is not healing, but like he said, it also has something to do with your daily diet. So if you see a person like Dr. Ruben or you see Dr. Ruben, ask about your nutritional diet or tell him about your nutritional diet and see if there's a situation where your wound is not healing properly because there's something that you are eating or not eating, or the level of water that you should be drinking and you're not drinking enough. So there is a such thing as too much water, but there's really a such thing as not enough water. Okay, so on that note, Dr. Ruben, I know I had some questions to ask you. I want to find out, what is telemedicine?
Telemedicine is a recently advocated form of medicine that's now provided by Skyping or FaceTiming. It's allowed me to reach as far as Czechoslovakia to give consultations to patients all over the world, and including in our own state, people who are up north that can't get the information that I can provide. You can FaceTime. It's now something advocated by the Infectious Disease Society of America. So we can help people even if I can't be on site.
Okay, that is wonderful. Now, but your facility is open 7 days a week.
That's right. We always tell people that bacteria don't know what day it is, so we give intravenous antibiotics for people with, for example, bone infections, and it's every day until their infections resolve. So we have to be open, and we have to provide that same care.
That's beautiful. 7 days a week. Okay,
yes,
okay,
ma'am.
that's wonderful. But there's something on here that I must know about. What is the wound dog?
Oh, well, you know, it's always been my passion to provide empathic care, compassionate care. So our office is very, it's unique in that the minute you walk in, it feels like home. We have 2 dogs, spaniels. They're inky in pocket, and automatically they bring out
joy.
the best and joy and comfort to any patient that that walks in. They're polite. They're very well trained, and you know, we also have Julie, who makes grilled cheese sandwiches. They're the best. So you know, it's important as a patient not to be intimidated by medicine.
Yes.
You know, medicine could be very intimidating, and you know, we've done everything we can to make accessing me and the services that we provide comfortable for somebody and dignified.
Okay, and you said the most word of all, dignified. There's a lot of people already embarrassed when they come. Okay, they got this gaping wound and, you know, this disfigurement on their leg or something or other, their arm, and they've been hiding it for so long. And then when they do want to seek a physician's help, you know, it takes a lot for them to do it, and then they don't want to see the face of a person twisted, like, wow, you know, or hear something like, why did you wait so long, and discuss. The fear was what the first thing that held them back.
That's right.
Right.
And you can imagine spinal cord injured patients who might not have control over their bowel or their bladder. They need to feel comfortable when they come to my office. So we've made the office completely accommodating to them. We have 5-foot wide hallways, we have a lift, we have a roll-in shower. So our office is built around people who are physically disabled.
Okay, that's beautiful. Well, I wanted to go over some of the brochures here on the table, and you mentioned some of the things. So first of all, this one here, Healing Wounds from the Inside Out. Now, you know, Dr. Ruben, let me ask you, can someone request this information in the mail or something? Because people need to know they can read about what it means to get help and then see some of the wonderful things that you do here to help. Okay, now I don't know if we can get a good shot of the inside of this, but I can tell you one thing, the back is just more interesting. So this is your roll-in shower?
Yes.
Okay, and then I see the chambers up here.
Hyperbaric oxygen chamber too.
Okay.
There's me working.
Okay.
You can see here in the corner is our nutritional. We have a place where we provide people with protein shakes, so I make sure people get their appropriate nutrition.
Okay.
In my office, I actually make sure that people are well nourished so that they do well. All that fancy stuff won't work unless somebody has the right amount of protein.
So they actually can get one of these brochures when they come to your office?
Not only that, we can send them
Send
to
it to
them,
them. Okay.
and they'll get a person on the phone when they call.
Okay, all right. Okay, and here, Healing Wounds, okay, this is another part of it. So this is your informational piece, more or less, but I see, once again, it's a close-up of the hyperbaric chamber and the shower, and what is this right here?
That's somebody getting an intravenous antibiotic.
Okay.
But what's really important to remember about that picture is that these services are being provided to reverse the reasons that people aren't healing their wound, like infection or a lack of oxygen. Some people when they have wounds, they call for wound care centers, and most of those are in hospital centers, or people are at home. And the most common treatment is to scrape their wounds on a weekly or bi-weekly basis for months at a time,
Yes,
and they're
yes.
focused on the wound and not the reason the wound isn't healing.
Okay, what is your new physician partnership program about?
Well, we have other physicians that are able to provide some basic wound care. And what we'd like to do is to let them know that when we see their patients, we provide more complex, sophisticated care, that they'll be able to return to their doctor.
Okay, okay.
So doctors don't get worried that they're going to lose their patients, and patients don't get worried that they're going to lose their doctors. We just want to be helpful temporarily and get people well.
Okay, well that's wonderful because, well, when people find someone that's helping them, they do want to stay away from someone that's like, well, he took too long, or no, he wasn't as great as I thought he was, but this doctor here, Dr. Ruben, is excellent. So, but the partnership keeps it clear that you can go back to your physician and work between the two of you.
You know, the best part is every patient wants to know that their doctors are on the same page. I pick up the phone and I call my referring doctors. Some patients are told that they should tell their doctor this when they go there, and somehow the message gets mixed up. But this partnership program allows me to be on the same page with the doctor who referred the patient. And by the way, people with wounds, they don't need a referral from a doctor because they know what they have.
Okay.
As opposed to some people who might have infections and are unclear as to which would be the right type of a doctor to see them.
Yeah, I'm glad you said that because a lot of people think that they probably can't come see you because they need to have a referral from the physician.
Absolutely not. If you have a sore that's not healing and it's been 4 weeks under care, please come see me. I'd be happy to get you
And
on
you
the
said
right clinical pathway.
Now, I heard you say before 4 weeks. So 4 weeks normally should be the healing process of a normal sore. Or
That's
wound.
right. And if
Okay.
you aren't healed in 4 weeks after going elsewhere and you don't know why your wound isn't healing, that's another reason to call us.
Okay, all right, Dr. Ruben, you know somebody's itching to talk to you. But ladies and gentlemen, let me say this before we close. You know how I am. I always want you to go to the website, justasktalkshow.org. You'll see Dr. Ruben's information there, as well as any of our other guests that you're interested in. But I always tell you, 1-800-323-5336. Twitter hashtag, and I know somebody has a question for Dr. Ruben. And I tell you what, if you should venture to see Dr. Ruben for any reason, give us a call and tell us how it went. Is that okay, Dr. Ruben?
That would be wonderful.
Okay. Okay. We like to be resourceful for our viewers, and we always know that someone says, well, if they've been on the Just Ask Talk Show, it must be pretty good. So we want to make sure that, you know, we at least hear some feedback, some positive feedback.
You bet.
Okay, okay. Well, Dr. Ruben, I would be pleased to have you come back and join us again and give us some more insight.
I'd be privileged.
Okay. Well,
I
ladies
sure
and gentlemen, you heard him himself. He will be back. We'll make sure. Okay. Thank you once again for coming. Okay. I'm your host, Marsha Florence, for Just Ask. Now, you know what I always say. Tune in and catch us anytime, either by web, YouTube, Facebook, or any of our stations, Comcast Detroit, Comcast Southfield, Birmingham, Bloomfield District, Novi, Lake Orange, CMN TV. You can catch us in most of all Channel 56, our home station. If you miss it, call me, 1-800-323-5336. I'm your host, Marsha Florence, for Just Ask. And what do I always say? If you know a person with a disability or if you just have a general question, don't be afraid to ask, just ask. I'm your host. Thank you.